Hey, welcome to this week's edition of the Huddle. It's a little bit somber, maybe a lot somber actually, as we enter the 1 year anniversary of the COVID pandemic. The World Health Organization in early March of 2020 declared coronavirus a global pandemic. And here we are, 12 months later. We've got a new president, but the stats are very sobering. Over 534,000 Americans have perished. Nearly 30 million Americans have contracted the disease. And we're just starting to roll out the vaccines. So this week, we've got a special edition. We're talking to a healthcare provider on the front lines. And basically, we're going to recap where we are, where we're going, and how the vaccines are going to help us create a new normal here in the US. All right, we're back. I'm Marc Ross. I'm joined, as always, with my colleague, co-host, good guy to know, Brendan Kownacki. Brendan, here we are 1 year later. I've identified March 11th is my 1 year anniversary. Your COVID anniversary is March 15th. Regardless, here we are 12 months later. What are your thoughts?
Mark, I remember it so vividly a year ago because I was filming a project. We had actually pivoted to try to make that project mostly a digital remote filming project, knowing that COVID was just starting to break into the national conversation. And then that very next day, restaurants were closed, offices were closed. And that Monday morning was it was the beginning of a new era for all of us. We've touched base a lot through the last 12 months, but obviously the only thing we can hope now is that we're turning a corner.
Yeah, absolutely. We've got, on the upside, one of the fastest rollouts, Operation Warp Speed, rolling out a vaccine. We've got 3 different choices here in the United States, which is amazing. Nearly 2 million of our fellow citizens are receiving some kind of jab, which is great news. And, I think there is some positivity. There is some normalcy around the corner. There's certainly a lot more energy and positivity. Maybe it is the sunshine and spring's around the corner. But I do think there's a sense that we're going forward, even though there are some dark clouds, especially what's happening in Europe, Brazil, other parts of the world. I read today, over 130 countries that haven't had any vaccines at all. So there's still a huge global challenge around this. But here in the good US of A, we are making steps forward, which is positive.
Yeah, so a new CBS News poll reports that 64% of Americans thinks the vaccine rollout is going well. And 55% of people say that they've either received a vaccine already or they plan to. So right now, this is an important positive metric. It's good to see that people are seeing brighter days ahead. Obviously, this is not over. What you were just talking about, Italy is planning to go on lockdown going into the Easter holiday. Several other countries in Europe are experiencing swells that certainly make us question whether or not new strains might be popping up and change the tide of this. But for now, we have to try to see the positivity where we can. I want to point to the remarks by President of the United States, Joe Biden, last week. What did you think when the president marked this anniversary that we're talking about and how he addressed the American people in his first big speech since becoming president?
Yeah, I'll say 3 things. I think the fact that I've never seen a president more comfortable in his skin. There was a moment where he was actually leaning over the podium. He used the words, "my fellow Americans," which I love. We have to remember, we elect the president from our collective citizenry. So to see that was great. Also, I'd never seen this before, just from an advanced standpoint, the use of all the flags of the states and various territories. I thought that was a really powerful moment. I thought it was a home run. I was speaking actually this weekend with a former cabinet official in a previous administration, and she was equally impressed. There's such a relief that there is an adult in the White House who knows what he's doing. He's moving forward. He's focused on the job at hand. And I thought the idea of bringing Americans into it, the idea of my fellow Americans, that was super powerful. What were your thoughts?
I thought this was a really appropriate speech for the time. And I think, like you said, Joe Biden is very comfortable in the office. He knew the job that it was. We so often look to the president in moments of triumph and terror. And, we're always waiting to know, what is the president going to say? It was a good speech. Maybe President Joe Biden won't be as eloquent of a speaker as Barack Obama, but he could be equally or greater of a leader. And so I think this was a really strong stance. He said to people that he needs them. He wanted to rhyme, the government's not coming to save you, but you're going to be able to save yourself. And I think that's a message that we heard early on in the pandemic about being in this together. And this was a strong reminder that it's going to be our collective that gets us past these latest set of challenges as we enter now month 13 of the pandemic.
Yeah, the whole idea, it is the United States of America. We are my fellow citizens. I can't stress enough how important that was to hear from the president. There's been a lot of discussion, maybe just from the White House press corps, that there haven't been enough press conferences. But when you get performances like that, there's really nothing left to say. I think it sent a very clear message to America and to folks around the world that America is focused, serious, and we got the task at hand and we know what we're doing. So I thought it was great.
It might be a little bit glib, but you know what? Joe Biden might be too busy governing to hold press conferences. So I'll leave it right there. Marc, I know you have a great guest lined up for today as part of our ongoing discussion with experts to look at what's been happening for the last 52 weeks with this pandemic. Tell me a little bit about our guest, Dr. Marc Stellingworth.
Yeah, Dr. Marc Stellingworth is a longtime personal friend, advisor. He's a board certified cardiologist based in South Carolina. He spent time in New Orleans. Really all around great guy. In fact, at the start of the COVID breakout in 2020, we had a radio podcast discussion. So it'll be good to have a recap of where we are. He's also been, on the front lines working at a hospital day in, day out, working in, very challenging environments, dealing with all kinds of complications in addition to the ICU, but also all the other things that still happen in the hospital. So it'd be great to hear from him what's happened with healthcare and where we're going to go. So I think I'm excited to hopefully have a positive conversation and keep this optimism going forward.
Yeah, it was a very interesting thing to be able to reflect back on some of your conversations a year ago when you were predicting that this was possibly going to go on for weeks or months, when some people thought it was just going to fade away one day. So let's take a look at that interview now.
Marc, how you doing, man? So we are a year after. We actually did a recording on March 15th, 2020. We also just passed the first anniversary when the World Health Organization declared coronavirus, COVID-19, a pandemic. I don't know. What a year, man.
A lot's happened. A lot has happened, to say the least. We've had a turnover in the White House. We've had the development rapid of a vaccine. I mean, we've had some amazing and pretty horrific things happen over the last 12 months. So seeing it on the ground floor has been pretty interesting, to say the least. We moved from hydroxychloroquine to remdesivir, and then moving on into convalescent serum and multiclonal antibodies, all that stuff. And now we're, finally at the vaccine stage. And hopefully, in the next several months, develop some form of herd immunity, and we'll see how that works out, though.
It's interesting, when we talked a year ago, and absolutely we've talked throughout this whole, crazy, life-changing experience. We were 4 or 5 days into it. Maybe there were a handful of deaths in the U.S. And now we're at, over 500,000 here in the United States. I think 2.5 million around the world. I wasn't prepared for seeing those kind of numbers. I don't know what you were. Just the devastation that this disease has caused is really shocking, to be frank. I mean, from my perspective, what do you think? I mean, you're much closer, obviously, to medicine in general, and just understanding how fragile life is and just how delicate the human body is. Should we be shocked by these numbers, or is it just how life is so complex?
Well, I think that obviously any loss of human life in this pandemic has been, pretty tragic. But there are a couple things that I would reflect upon. One is that the pandemic in itself, 500,000 Americans lost their lives, more than 500,000. But it could have been much worse had we not taken the dramatic steps early March. And then we had, kind of a second and third wave because of, some lightening of the guidelines. and then some, and then just some holidays. Honestly, January was probably the worst month for for the United States when it came to infection and maybe not necessarily with deaths. But the thing that's really interesting is that it uncovered what I think is a fundamental flaw within the healthcare system, is that the availability of beds in the communities, outlying communities, not the major metropolitan areas, was a significant problem. We had difficulty transferring just fundamental patients like heart attacks, heart failure, valve issues to other campuses because they were occupied by COVID patients. And the extenuating, the incredible length that these patients could stay on ventilators, and then the sequela that would happen after that. I mean, it had a serious impact on the entire healthcare system. So not only were lives lost just with COVID, which are obviously horrific, but they were also lost because we could not get people to tertiary centers in a timely fashion. So that's, I think that's one of the things that going forward we need to really start thinking about, is that we talked about closing down these community hospitals because, for greater efficiency and kind of these hub and spoke models where, we would send our patients, to this centralized center. But I'm not sure that that's necessarily the best thing, particularly in a pandemic. And that may change our may reframe our argument about our healthcare access in this country.
Yeah, and there's an article, I have no idea where this, but I think it was in the last few weeks, just about the amount of death overall in 2020 was, historic. I mean, not only just from COVID, but from all the other activities. And the whole infrastructure around this, I mean, we're still obviously going through this. We haven't had a lot of time to process it, but just how we handle healthcare in this country and just the access to assets is really amazing. Italy, I read today that they're creating some kind of like healthcare train where they'll literally put on people, take them to bigger population centers that have more infrastructure to handle healthcare. I don't know. I mean, this is such a black swan event, but you have to think that the next generation is going to be better prepared for a pandemic, and we'll have a better sense of like how to scale up and respond more quickly, which is probably a positive coming out of this.
Yeah, I think it's an indirect byproduct of globalization to a certain extent, simply that, when you have an interconnected world like we do now, what happens in Wuhan, China is going to have an impact here, can have an impact here in the United States. And the next, we don't know where the next virus is going to come from. The last serious pandemic was in 1918, and we're over 103 years from that. But I suspect that the next one will happen much sooner than that. And I think we will be better prepared. I also think that we're going to be better prepared just to handle routine infections like pneumonia and flu and all of those things that I think have kind of opened our eyes to the possibilities of just simple changes that we can make in the way that we manage patients can reduce infection and help decrease the spread of these diseases and have a positive impact long term.
No, I love that you bring that up, because I remember, obviously we talked, going back to March 15th, listening to that recording and, just being marveled by like what Boris Johnson was going to do, or was Sweden going to do with her immunity, right? And then, I remember talking to you maybe 6 months into this, just saying, hey, we've got a better sense of like what to do when a COVID patient comes in. I mean, those early days, there was really no idea what the hell to do. And you were talking about the different vaccines or treatments or, and obviously it does seem like, I don't want to put words in your mouth, but I imagine as a healthcare professional, this has been like an additional graduate degree, because it's just the amount of additional research and time you're spending with patients and figure out how to better care for them. Hopefully that's going to be a positive outcome as we perform and go forward. No?
Yeah, I would agree with that. I think that I've got two new graduate degrees, since I finished my training. One was during Hurricane Katrina, and handling a massive disaster that happens rapidly. And then you have something like COVID-19, which is kind of a slower moving, disaster, but still obviously has significant consequences. But the thing that kind of unites those two is the lack of information at the beginning. And so then you don't know what you don't know at that particular juncture. And you're trying to treat these diseases the best way that you can, but ultimately, it takes time and it takes resources to better understand what's going on. Remember the toilet, the toilet paper runs on, in the beginning of the pandemic, and people, hoarding food and all of those things. And our infrastructure obviously could withstand that, but at the same time, that's the kind of paranoia that can make managing, an illness and managing a disease like this really, really trying, So that's something that we need to, going forward, we need to realize is that better information management can play a significant role in managing and controlling the population and having a better impact in our communities.
As we're recording this, Joe Biden spoke, kind of 50 days in office, but also, gave a really impassioned speech about, I need all my fellow Americans. We need to work with you. The U.S. government's buying more doses. I see in the state of Michigan just put out an announcement. They said everybody under or above the age of 16 by April 5th will have, access to the vaccine, which is amazing. Speaking of New Orleans, I think they're restarting live music. Texas, which is, don't mess with Texas. They're going to allow the Texas Rangers to have a full stadium on opening day. There is a lot of excitement, a lot of energy, but me personally, I'm like, are we going to see another wave in a few months? Shouldn't we be more cautious? We still only have a handful of our citizens vaccinated as we speak.
Yeah, I agree with that. I think that it's a bit premature to be opening up, the stadiums for a Rangers game. But I can tell you on the ground, on the ground here, we're talking about relaxing the restrictions that we have even in the hospitals. Right now, nobody can stay with patients at this point. And so we're starting to think about that, but we're thinking about it in a much more gradual fashion. But I had a conversation with one of the internal medicine physicians here, and getting kind of towards the herd immunity idea is that we've had a lot of infections already. People have been exposed, people who basically survived those infections. And when you add that in conjunction with the vaccine, I think we're probably closer to herd immunity than we actually anticipate. But I think that the CDC is probably reluctant to go forward and be like, yeah, everything's great now. But I think that I'm cautiously optimistic about this, but I really do think that we've turned a corner. And I really do think that we're probably moving back to normalcy before 2022. I am worried that, people will get a little too enthusiastic. And maybe we might have a fourth wave, particularly with the variants that we've seen, in Great Britain and the South African variant. So we have to be a little bit more concerned about that. But at the same time, I am cautiously optimistic that things will return to normal. I actually have to say that I thought that Biden's speech was pretty amazing, and I think Politico was pretty spot on when they said that this is why Joe Biden was elected president. He is meeting that moment, that the loss that he experienced early on in his career as a senator basically paved the way for this moment for him to, I think we as Americans recognize that he actually understands the suffering of the common American. And I think that, you won't get much praise from me from President Trump, but I think Operation Warp Speed, played a significant role in the turnout of this vaccine. So he does deserve credit there. But I think that that's the fundamental difference is that, I think that President Trump had a tendency to downplay it, to try and minimize it. And I think that if he had leaned into it, he could still be president at this point. But I think that Biden, because we recognize the suffering that he's had in his biography, he could really give that speech that he gave yesterday.
No, 100%. I thought, he's the right man for the job. My wife said while she was watching it, she's like, this is deliciously boring. This is like the guy, there's no theatrics. There's a guy laying out the plan. Also, like physically, the way he was like hunched over the podium, talking and he used the word "my fellow Americans," which I think is super powerful because that we elect the president from our citizens. And I think he's the right man for the moment. I think the empathy he's gone through, like he's actually buried members of his family, is super impactful. And I thought it was a real turning point. It's interesting you're saying we may already be at herd immunity. CDC is probably going to be a bit.
No, that's not what I'm saying. I'm not saying we're at herd immunity. We're closer to it than we actually. Sure.
Okay.
That's all I'm saying.
But we should all still get the vaccine. You would advocate for that. And we should still be cautious and kind of play it safe and don't do anything too crazy, like going maybe to a large sporting event in the short term.
I do want to, discuss a little bit about the politics of the vaccine. When it comes to the domestic side, the first vaccine that we had was the Pfizer vaccine, which was basically 2 doses, and but it had to be refrigerated. And because of that, there was limited access of the vaccine in rural areas where I practice. And so I think there was a real fundamental divide about, with that. And I think that also, and this is only anecdotal, and this is just me talking, I'm not speaking for anyone else, but I do feel that there was some resistance in communities of color to actually embrace this vaccine. And I think that, going forward, one of the big domestic problems that we have with this rollout is not necessarily a problem, but a challenge, shall we say, is that we need to bridge that rural divide, and we also need to, convince communities of color that this is in their best interest. And that's a real challenge. I think it'll be easier with the Johnson & Johnson vaccine because it doesn't have to be stored at such a cold temperature, and it's a single shot. So I think going forward, we'll be able to meet those challenges. But at the same time, I think that there's a lot left to do before we, put this behind us, long term.
Yeah, 100%. The polling I've seen, you only have like 65 to maybe 70% of U.S. citizens actually want to take the vaccine. That leaves like 100 million people in our country that don't want to take it. That's a huge number. And also, going across the pond, the AstraZeneca vaccine, which is being manufactured in the UK, already as we're recording this, several nations have either put a hold on that or suspended the use of it because of various, blood clotting issues or people suddenly dying from taking the vaccine. And there may be no direct causation to that, and it could just be other underlying issues. But certainly there is a resistance for people to take something that is fairly untested. We are only several weeks into this.
Well, so going back to the Pfizer vaccine, it is a mRNA vaccine which has never ever been utilized in a vaccine. And to that point, there are several physicians that I know personally who won't take it because they are afraid of the side effects. I took the vaccine, and the majority of the physicians in my community did. So there is some resistance. It's a double-edged sword. You're trying to roll this thing out as fast as you possibly can to immunize as many people as you possibly can, but there are consequences, to these vaccines that may be unforeseen. So you have to be careful with that. I think that AstraZeneca, they're going to put a pause on that and probably do some research and figure out what's going on. But COVID-19 itself can produce a hypercoagulable state.
Yeah, that's what's interesting. I've heard that.
Yeah. Is it a byproduct of the vaccine, or is it indirectly a byproduct of the infection itself? And that's the other thing that goes back right to the beginning of this conversation. We don't know. The greatest problem that we have right now is a lack of information, and I think that once when we look back on this, 15 years from now, it'll be clear, the things that we did right and the things that we did wrong. But it's hard when you're sitting in the middle of it to make that decision, of where to go forward. And I think that eventually AstraZeneca will figure out the reasons that their vaccine has an issue. But I think that if memory serves, I think Johnson & Johnson's vaccine was not as good against the South African variant as it was against,
getting to a city that we both love, the city of Detroit, the mayor of Detroit famously was offered the Johnson & Johnson vaccine. I don't know the number of quantities, but I guess the numbers, it's only 60 to 70% effective, and maybe the other vaccines are closer to 90. And the mayor of Detroit said, I don't want the Johnson & Johnson vaccine. 2 hours later, he said, well, I misspoke. We'll take it. We presume we probably got a call from the White House. But that kind of, you're spot on, like that kind of access to information or disinformation or uncertainty, especially coming from elected leaders, is not helpful at all. And last night, as you talked about, Biden was like, listen, I'm going to tell you the truth as much as I know it. And we're going to say, I'm going to deliver the facts on the situation. That's probably the best we can hope for.
One point of correction here, though. I think that if memory serves, the about 30% of Americans are reluctant to take the vaccine.
Probably any vaccine. right? In general, that's part of the issue too, right?
Well, then the other thing, though, is that if you look at the Trump voters, 47% of them are unwilling to take the vaccine. So that's a pretty large disparity there. And I think that also goes to the some of the other issues we saw with January 6th and all these other things, that there's a lack of trust in government. It has been a constant diatribe of the right and to a certain extent, even of the left, that, government is inefficient, government is not doing its job, government should stay out of our way. And now here we are, like, relying on the government to do one of the largest rollouts of a vaccine in the history of our country, and furthermore, a $1.9 trillion, package to ease the suffering of Americans, but also, there's child tax credit in there. There's, it's one of the most progressive, bills, in American history. This is an example, hopefully, of, government working for us, and that's a hard thing to sometimes, swallow, that actually when we come together and we unite, we can actually do something pretty amazing.
You have anti-vaxxers on the left.
For sure.
You got the anti-government folks on the right, which is going to lead to, which I want to talk to you about, this idea, which is being kicked around, kind of vaccine passports to allow more travel. And are you going to have certain employers that are going to demand that their employees take the vaccine so we can return to some kind of normalcy in the workplace, and just all the unintended consequences around that, civil liberties? We haven't even vaccinated enough people, and yet we're already seeing challenges to why people might even want to take the vaccine, and how we're going to deal with that as a nation is going to be interesting.
Yeah, I agree with you. I think that, when it comes to the passports, I think that, if you want to go to another country and they're requiring that, I don't think that, I don't think you're in any position to argue against it, that it's an infringement on your civil liberties to do that, because you're traveling to another country. I mean, I just don't think I think that's unreasonable. When it comes to, corporations mandating that you take the vaccine, in order to return back to work, well, I think there may be some issues there. There may be some questions about that, particularly people who've already been infected. We're going to have enough vaccine, by May, for every person here, hopefully in the United States. So, I mean, if you don't want to take it, that's fine, and you can stand on principle. But the fact is that there are consequences to that stand.
We have to assume that COVID is going to be around us almost, I don't know, it's going to be like the flu kind of situation. Like, people, even next year or 2-3 years out, are still going to die from COVID because it'll still be lingering? Or do you see this actually burning out?
Well, I foresee that it'll probably be a chronic problem. I don't see it as a, just something that flares up and goes away. I think that its impact in the community will be less because more people will be vaccinated, more people have been exposed. But that doesn't mean that it's ever going to go away.
Well, it'll be like a flu. I mean, it'll become like a flu kind of situation where as a society, there'll be a tolerable number of deaths, whatever we feel that is as a country. And it won't be so taxing on the infrastructure.
And the other thing is that we know how to treat it a little bit better now. And we can risk stratify people a little bit better. And we have medications that can actively treat these people. So, for example, one of the people that one of the physicians I was talking to just yesterday had said that, in January, about half of the patients that he had in the hospital were COVID positive.
Wow.
Half. Yeah. And so it really, essentially, it was bad in January, got really, got to its worst probably early February. And then after that, it started to trend down. But now he's got, 2 patients, that are COVID positive. He's sending them both home, actually sent them home today. The treatment, will be there, and we will be able to effectively manage these patients because we've seen so many of them now. And I think the pooling of resources internationally will allow us to develop the best strategy. Will it ever go away? Probably not. But I do think that I do think that we're going to have a strategy, and less people will die from it than in 2020.
Let's go international. So, Mexico reportedly is going to buy almost 36 million doses of the Chinese-made vaccine. The Russian vaccine is going to be manufactured in Italy. There's reports now that the U.S. working with India is going to help, vaccinate hopefully Southeast Asia, competing against China. Is this soft power diplomacy nonsense? Is it important? Is it just the way the world is structured and just don't worry about it and get on with it?
You and I have had this conversation multiple times. So 100%, this is a soft power move. I mean, who is best positioned in the Indian Ocean to counter the Chinese? Well, it's probably India. And so our relationship with India is absolutely essential, and playing a role in their vaccination program is a huge deal. I wholeheartedly agree with that. Russia, making a play for that also is a power play to demonstrate that they're still in the game when it comes to, international politics. And then obviously the Chinese, it just goes hand in hand with their Belt and Road program and all the other things that Xi is trying to do to demonstrate that he's a capable leader. And I think that, and I think it's even more important for Xi to have a vaccine available to his citizenry than the United States, because I think that, the legitimacy of the Communist Party rests on the fact that they take care of their citizens and provide them with some degree of economic comfort, but also, I think that, having that vaccine plays a huge role for Xi to legitimize his power.
Yeah, the China stuff I'm really fascinated by. Their reported deaths and their reported cases are minimal. I mean, I think they've only like 15,000 deaths, 100,000 reported COVID situation. Their vaccine rate is now like 0.4%. Like we're at like 1% of our population, or one for every 100, which I guess is 1%. And then you get the 2022 games, the Olympic Games, that Beijing is going to host, and they're not even going to reach herd immunity in 22 for the Winter Games. I mean, the internal stuff around China, yeah, it's really, really fascinating. And we're living in a world that's much more global, and we've got to trust other nations that are pulling their weight. It's going to be hard to kind of circle that square.
I'm going to go out on a limb. I don't think we're going to attend the 2022 Olympics in China.
Dr. Mark making news here.
No, I'm 100%. And I think the rationale will be multifactorial. One is the treatment of the Uyghurs is, it was labeled genocide by the previous administration. I don't think that the Biden administration has gone out that far to say that, but I think that, there's going to be serious pushback for the United States to go there after making those kind of declarations and those kind of human rights abuses that we've seen, in China. So that's just one component. And then when you add the fact that they may not be completely immunized by the time these games start, and then I also think that look at the policies that Biden is employing right now. Are they that dramatically different from Trump from the previous administration? No. So I don't think the economic component is gonna be conducive unless there's some serious breakthrough. I just don't see how those three things don't prevent the United States from attending.
Well, I think our friends at the Comcast, Peacock, NBC Sports Network probably have a different opinion.
I'm sure they do, but that doesn't make it any less correct. So,
we'll see. But no, you made some news here. As we close out, let me ask you, what should we be doing to make the lives of healthcare workers better? I mean, I think about, as you know, I'm terrified of going to the hospital. I can't imagine doing it as a profession. I think the work you do is just amazing. I think the work the nurses are doing, I think people that got to show up and help deliver food, just amazing. Anything we can do as normal citizens who aren't really on the front lines, aren't on the coalface dealing with this day in and day out.
There are a couple things. One is, first, I want to echo your sentiments on this. Look, I'm just a cardiologist, okay? And, I...
yeah.
Well, no, I mean, seriously, I'm not on the front lines, okay? There are, hundreds of, there are hundreds of nurses in my community. There are hundreds of primary care doctors. There are hundreds of nurse practitioners. They're on the front lines dealing with this on a regular basis. And I have to say that, from a mental health standpoint, it has been very taxing on them to deal with, patients who get sick, have a prolonged course, and then they end up dying. And there are a lot of patients, in my practice that have passed away because of their illnesses, because cardiovascular disease is number one, a very large risk factor for COVID exposure. But I think that one of the things that's unappreciated by the communities is the mental stress that, physicians and nurses and other primary care providers have to undergo every day, to deal with things. And I think that there's a certain stigma for physicians and primary care providers to seek help. And I think that that's a fundamental problem. If we could, I think mental health in the United States has been an under-addressed issue since the Reagan administration. But I think that if there's anything that could happen that could help physicians and primary care providers is basically to be able to reach out and say, I need help. I'm having trouble with this. I'm struggling with this, and I need some help. And not to be ashamed of it, and not to be, and to have the resources available to them so they can address it. It's been a really hard year for primary care providers in this country, and some of them have lost their lives treating the patients in our communities.
Yeah.
And what more do they have to sacrifice in order to make progress on the mental health side? I just think that's doing them a great disservice.
Well, I appreciate you making the time. I appreciate your work. I appreciate your friendship. Hopefully I'll get to see you in person sometime in 2021 and we can have a meal together.
Maybe.
Maybe.
I don't know. We'll see. Hope springs eternal. Hope springs eternal.
Maybe we can go to the Winter Games in Beijing. If the U.S. doesn't go, maybe we can go. Maybe I can finally make the Olympic team.
Mark, I appreciate that discussion with you and Dr. Mark. What can I say? This has been a challenging year for all of us. And as we talk about on the Huddle, trying to have people in the inner circle around us who can give us smart information. And that's what we're trying to do. And we're trying to spread that wealth of knowledge to our listeners and viewers. So I really appreciate the discussion you had.
Yeah, it was great. I mean, like I said, Mark's been a longtime friend, advisor, super smart and, honest. And I thought it was a great insight on where we've been and where we're going.
While we do have a little bit more of a somber tone today, we still have one thing left to do. Mark, tell me about who you would put in your huddle this week for the pandemic anniversary.
So keeping it around a healthcare and wellness theme, I'm going to go with Karen Lynch. She is the new CEO and president of CVS Health. As you know, CVS is a retailer, is pivoting to a end-to-end healthcare and wellness company. They have over 9,900 locations around the U.S. And in fact, the company's been tasked with delivering almost 20 million vaccines. And she's on the front line of leading not only a transformation of the company herself, but helping to vaccinate Americans at an unprecedented time. So she's in my huddle this week.
Yeah, locations like that are definitely going to help us keep this going. Yesterday, the United States delivered 3 million vaccines, which is stunning news. And I think retail locations like that are going to help the cause.
How about you? Who do you have?
I'm looking at the bigger side of that, which is trying to get people into those locations to get their vaccines. I'm going to pick, as always, the ex-presidents. This is a group that I would always pick to have in my huddle. They released a public service announcement where we've got video now of Presidents Carter, Bush, and Clinton and Obama receiving their vaccines along with their wives. It's inspiring, of course, to have these leaders and know what they've done, but to see that they're always still united for keeping America safe. And of course, that makes us reflect on the one man who's not in here. I hear he was invited, but chose not to participate. But as always, the ex-presidents, they got their shots. When you have the chance, go get yours. I think that's the message we need to spread.
100%. I agree totally. I can't wait to get jabbed myself. So for this week, thanks for joining everybody. This was The Huddle, your destination for inner circle analysis. We'll see you soon.